Is it a drug war or a trade war? We've had a lot of tariff talk lately. That's because the Trump administration is using tariffs, they say, to pressure Canada and Mexico to stop illegal drugs, and in particular fentanyl, from entering the U.S. Now, no one wants fentanyl here. That shouldn't be here. It's a dangerously addictive synthetic opioid that over the last 20 years has killed, roughly 430,000 people, the whole category of illegal opioids. That's according to the CDC. And government data shows, here's the thing, a majority of the illicit fentanyl coming into the U.S. comes over the Mexican border. That's the seizure rate last year. Less than 1% was seized at the U.S.-Canada border. Canadian leaders looking at those numbers say, look, fentanyl concerns are a pretext for the Trump administration's tariffs. And yesterday, President Trump's top economic advisor said, no, they're not a pretext at all. The administration started a drug war, not a trade war, and claimed that Canada, despite those numbers, is more problematic than the data suggests. Take a listen.
I mean, Canada's not a major source at all of fentanyl in the United States, are they?
Well, yes, they are a major source. And I can tell you that in the Situation Room, I've seen photographs of fentanyl labs in Canada that the law enforcement folks were leaving alone. Canada's got a big drug problem, even in their own cities. Go walk around, Toronto and see what it's like, and you'll see that it is a big problem.
But we haven't seen an iconic streaming series about a Canadian fentanyl dealer yet. Joining us to talk about all this and whether it's the best approach to reducing drug deaths is a deputy director of the nonprofit Drug Policy Alliance and the author of The Harm Reduction Gap, Sheila Vakharia. Sheila, thank you very much for being here.
Good morning. Thanks for having me.
Fentanyl kills so many people. The whole family of opioids, illegal opioids. No one wants them here, but drug enforcement is always a question of, do you take on the supply or do you take on the demand? How do you feel about this effort to take on the supply?
Well, one thing that we know is that most of us are impacted by the overdose crisis, right? I myself am a social worker, I'm a former addiction treatment provider, and I'm someone who's lost loved ones to the overdose crisis. So I understand, like anyone else, that we are looking for solutions. But one thing that we know is that solutions that work are often grounded in public health and supporting the people who use drugs themselves. We are actually seeing declines in overdose deaths, potentially for the first time since the beginning of the COVID-19 epidemic. We lost over 100,000 people to overdose 3 years in a row, and there's some signs that last year we saw reductions. And why did these reductions happen? It wasn't because we were proposing a war against our enemies. It isn't because, or against our allies, so-called calling them enemies, right? Or even proposing tariffs. It was because we invested in our communities at home. We used valuable resources from the federal government, the state governments, and local governments to provide access to life-saving supports. Naloxone, the opioid overdose reversal medication, is more available in our communities than ever. People can respond to overdoses in their own homes and save lives. Medications like buprenorphine and methadone, which are effective treatments for opioid addiction, cut the risk of overdose in half. More housing supports, more overdose prevention, more recovery supports, more veteran services. Those are what's saving lives.
But is it an either or here? I mean, you could do all those things that you say work and also cut down on the supply using tariffs. Do you think there's a role for that?
So the problem is that even the administration is pitching this to us as an either or, because they want to fund more enforcement at the cost of treatment. And where they want to cut money is often from Medicaid, from SNAP. There's talks about cutting Social Security. There's talks about cutting Veterans Affairs and education. So actually, the administration is forcing us to choose between strategies that help Americans at home in their own communities or trying to look for a needle in the haystack at the border, trying to find a pack of fentanyl in someone's tire when we know that you could use that money, those trillions of dollars, to actually support our communities at home.
The Drug Policy Alliance calls the claim that tougher enforcement leads to safer outcomes simply a myth.
It is absolutely a myth because it redirects our energy away from the source of the driver of the drugs coming into the country. As long as drug demand exists, people are medicating pain, physical pain, emotional pain, stress, anxiety, instability with drugs. And as long as American people are using drugs to self-medicate, those cartels are going to find ways to bring drugs into the country. So there's only so much we can do at the border when we know that actually addressing drug demand, helping people who want to get off drugs, helping those who are using to be safer, and to connect them with resources in the community to get the help that they need.
Connect with resources in the community sounds very casual. And if you're dealing with a drug addict, as many people have had the unfortunate experience of dealing with, they don't want to. You can't have a gentle choice. It's got to be. That's why prison is often a moment of reform for people. Do you support enforcement on that end of the equation?
So as I said, I was actually a former treatment provider myself. About a third of my clients were mandated treatment through the criminal legal system. And one of the things that I often found was that the harshness of the penalties that they were facing didn't actually get to the underlying reasons that they were using drugs. And so oftentimes when their mental health stirred up, when they were having troubles at home, their probation or parole officer often saw their use of drugs as a violation rather than an attempt to deal with their problems. And then being put into the jail or the prison actually just created a revolving door of harsher penalties, being disrupted from services, and then not actually getting the help they needed inside and coming out less at advantage to be able to get connected.
Still a huge problem. Sheila Vakharia, thank you so much.
Thank you so much.